Hi, so I'm recording this video. You know who you are. She's just had, if you've had any type of knee surgery in your post-op and your home health physical therapy isn't doing much, this is something that you can easily do at home. So what we'll have is this Pilates circle. You can get this anywhere. I've seen them at TJ Maxx. I've seen them at Amazon. If you just type in Pilates circles, you can find this. So I'm going to start out in a seated position first. Oftentimes when we have knee surgeries or total hips or knees, whatever, the post-op rehab is really, really hard. And so you're not going to have enough muscle connection to get the full knee to extend. So today we're going to kind of work around that to make sure that we're able to address all of it. So the first priority for me is to keep you safe when you are ambulating, or functionally safe when you're walking, so that you don't tip over and lose balance. So in a seated position, you can choose to sit on any type of chair. It doesn't have to be this high up. You're just going to sit up nice and tall. Remember that your spine stays perpendicular to whatever surface that you're sitting on. So sit up nice and tall. Feel free to place your hands down next to your bum or your buttocks to make sure that you're upright. And then you're going to lift your right knee up and hold it. 1, 2, 3, and down. Again, 1, 2, 3, and down. 1, 2, 3, and down. Slow and steady is best. Going up and coming down, collapsing down, that does nothing for you. We're not about momentum. Make it count by taking it up, holding it, and then really controlling the descent. And that's key. Up and down. Remember, I'm not there in your living room, so make sure that you do it so that it counts. It really works your hip flexors, which is what you need to clear your foot when you're walking. So I want you to do a set of 10. So I'm going to demonstrate 2 more, and we're going to move on to the left side. Up, 1, 2, 3, and down, 1, 2, 3. Up, 1, 2, 3, and down, 1, 2, 3. Up, 1, 2, 3, and down, 1, 2, 3. Just that small set really gets me pretty sore into my hip. Take it up, 1, 2, 3, and down. 1, 2, 3, and down. 3, 1, 2, 3, and down. 1, 2, 3, and down. That's 5, 6, 1, 2, 3, and down. Remember, going down is more important. Making a deliberate attempt to go down as slow as possible. Up, 1, 2, 3, and down slow. Up, 1, 2, 3, and down slow. So if you can do that throughout the day, 3 sets of 10 is ideal. So see what you can do with that. And then next, I'm going to go ahead and lie on my right side. This really helps your hip, really the gluteus medius muscles, the muscles that helps you walk is what this does. You're going to keep your knees, I don't know, bring it up like 90 degrees or maybe 45. All I want you to do is keep the heels together. You're going to go ahead and inhale up and down, nice and slow. Make sure you're not swaying back with your spine, right? Your spine is nice and on its side, right? Pelvis is on top of one hip on top of the other. So it's square, it's not tilted forward or back. So keeping your heels together, you're just opening the knees up as high as possible. And again, don't collapse down, go as slow as possible down. And up, 1, 2, 3, and down. 1, 2, 3, and down. 1, 2, 3, and down. It helps to have your left hand right in front of you so you don't tip forward or tip back. Up, 1, 2, 3, and down. Don't worry so much. I don't care how far you open that knee apart. I just care that you don't sway your hips back or your spine back, right? So initially, you're not going to have a whole lot of strength in your bottom muscles to get them apart as much. Up, 1, 2, 3, and down. Up, 1, 2, 3, and down, slow. And I'm really feeling it in my hips. That's the thing. This is really potent stuff. And back down. Obviously, we have to do the opposite side. So is the camera okay? All right, so we're going to do the right side now. So for you at home, you can just flip over to the opposite side. For the purpose of us recording today, obviously I have to face you. So this is what we're doing. When you look down, make sure the knees are aligned, the hips on top of one another. You're directly on your left side, that you're not swaying back, right? We don't want this to be a low back motion or spine rotation here. We just want to isolate it to your hip. So your right hand now in front of you to hold you steady and honest. Heels together. Lift the knees apart. 1, 2, 3, and down. Slow. Up. 1, 2, 3, and down. Slow. 2. Up. 1, 2, 3, and down. Slow. 3. Up. 1, 2, 3, and down. Slow. 4. Up. 1, 2, 3, and down. Slow. 5. Up. 1, 2, 3, and down. Slow. 6. Up. 1, 2, 3, and down. Slow. 7. 1, 2, 3, and down. Slow. Up. 1, 2, 3, and down. Slow. Last one. Up. 1, 2, 3, and down. Slow. Good job. Just with that, pretty sore. All right. So next, you're going to go ahead and lie on your back. We're going to bring out this hip circle, put it between your knees. Keep your feet about hip width apart if you can swing it. So it doesn't matter how far you squeeze this hip circle, but you're going to do it gently, okay? You're going to push in 1, 2, 3, and release. Again, 1, 2, 3, and release. Nice and slow with control. 1, 2, 3, and release. 4. 1, 2, 3, and release. 5. 1, 2, 3, and release. 6. 1, 2, 3, and release. 7. 1, 2, 3, and release. 8. 1, 2, 3, and release. And 9. 1, 2, 3, and release. And 10. 1, 2, 3, and release. Again, you're going to do all these exercises. 3 sets of 10 is ideal in one sitting, but try to do them throughout the day. 2, 3 times a day is a good thing, okay? Lastly, this is the easiest one. And this is particularly for those of you who just recently had knee surgery and you can't quite extend the knee all the way. You're just going to keep your heel down. We're going to do what's called the heel slide. So you're going to heel slide. Slide your right knee up and then lift your heel up off the mat and then bend back. Again, push, 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 and bend. Push, 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 and bend. You know what? You can have a bolster under your knee. That way you have something to extend against, right? It's a easier knee extension. Push up. 1, 2, 3, and down. And extend. 1, 2, 3, and down. And 3, 1, 2, 3, and down. 4, 1, 2, 3, and down. 5, 1, 2, 3, and down. 6, 1, 2, 3, and down. 7, 1, 2, 3, and down. 8, 1, 2, 3, and down. And last one. 1, 2, 3, and down. Same thing on this left side. I'm going to move my right leg out of the way so you can see. Straighten. 1, 2, 3, and down. Straighten. 1, 2, 3, and down. Again. 1, 2, 3, and down. If you don't have a bolster, you can just use a pillow. And down. Again. 5. Release. 6, 1, 2, 3. 7, 1, 2, 3, 8, 1, 2, 3, 9, 1, 2, 3, and 10, 1, 2, 3, and bend, and bring it back. So again, 3 sets of 10. I hope that helps. I'll see you next time.